So Namaste Andi, I am Dr. Shanta Kumari. ఇప్పుడు అరుణ చెప్పినట్టు ఐఎమ్ ద FIGO International Gynae Society Treasurer and the immediate past president of FOXY. FOXY అంటే Federation of Obstetrics and Gynaecological Societies of India. I was the All India President last year. And మన హైదరాబాద్ సొసైటీ ఏమో Obstetrics and Gynaecological Society of Hyderabad, OGHS. I am the current president of OGHS. So we are very happy to have you all here. A warm welcome from Obstetrics and Gynaecology Society of Hyderabad. మిమ్మల్ని ఎందుకు ఇవాళ పిలిచామంటే we wanted to update you about the 66th AICOG, All India Congress of Obstetrics and Gynaecology, which the OGHS is doing for the FOXY, and we are conducting this conference from 6th to 10th of January at hicc High-Tech, Hyderabad. So we wanted to update you about this AICOG Congress, so we are here. So I am the organizing chairperson of the Congress. Dr. Vindhya, T. Vindhya, she is the organizing secretary of the Congress. Madam is the past president of Obstetrics and Society of Hyderabad Society. And Dr. Aruna Suman is the organizing secretary of this AICOG Congress. Madam was the vice president of OGHS. And we have Dr. Jamuna Devi, Madam, who is the treasurer of the Obstetrics and this AICOG Congress, and Madam is the past president of FOXY Hyderabad, which is OGHS. So we just wanted to update you about this AICOG Congress. Now the AICOG Congress is the mother of all congresses of FOXY. The All India Congress, which is the main congress of the FOXY. Every year it rotates in one zone, north, south, east, west. So in south, this has come to our city, Hyderabad. We had conducted this AICOG thrice before. The last time was in 2011, where I was the organizing secretary and they were the organizing joint secretaries. That time we had done this at same hicc High-Tech. And before that, in 1998, Hyderabad Society had organized this Congress. And before that, in 1958, the first time AICOG had come to Hyderabad. So this is the fourth time the All India Conference has come to Hyderabad. So it's a matter of great pride that we are organizing this All India Congress at Hyderabad, because this is where most of the gynecologists will be attending the Congress. We have about 40,000 people in FOXY. So usually the All India Conference AICOG about 10,000 people attend the Congress, especially depends on the place. Being Hyderabad, we are expecting a good crowd. We are going to have more than 11,000 delegates at Hyderabad from 6th to 10th of January. So why is it that AICOG is very important? మీకు తెలుగులో కొంచెం చెప్పాలంటే ఆల్ ఇండియా కాంగ్రెస్ ఆఫ్ ఆబ్స్టెట్రిక్స్ అండ్ గైనకాలజీ అంటే ఇది మా ఫాక్సీ యొక్క ముఖ్యమైన కాన్ఫరెన్స్. ఇది మనకు 4వసారి హైదరాబాద్కి వచ్చింది. ఫాక్సీ హిస్టరీ 70 years. ఇన్ 70 years ఆఫ్ హిస్టరీ ఆఫ్ ఫాక్సీ మన స్టేట్కి ఇది 4th టైం మనము కండక్ట్ చేస్తున్నాం. దాంట్లో ఇన్సిడెంట్లీ థర్డ్ టైం అంటే 2011లో కూడా మేమే ఆర్గనైజ్ చేసాము. ఇప్పుడు 2024లో కూడా మేమే ఆర్గనైజ్ చేస్తున్నాం. వీఆర్ వెరీ హ్యాపీ. ఇది ఎందుకంత ఇంపార్టెంట్ అంటే ఇది ద మెయిన్ కాంగ్రెస్ ఆఫ్ ఫాక్సీ. ఫాక్సీలో వీ హ్యావ్ అబౌట్ 40,000 గైనకాలజిస్ట్ ఆల్ ఓవర్ ద కంట్రీ. 270 సొసైటీస్ ఆర్ దేర్. 270 సొసైటీస్ ఉన్నాయి ఆల్ ఓవర్ ద కంట్రీ. సో ఈ అన్ని సొసైటీస్కి కూడా చాలా ఇంపార్టెంట్ కాన్ఫరెన్స్ అంటే ఈ ఆల్ ఇండియా కాన్ఫరెన్స్. ఇది కాకుండా ఇండివిజువల్గా జోనల్గా చాలా కాన్ఫరెన్సెస్ అవుతాయి, బట్ దిస్ ఈస్ ద మెయిన్ కాన్ఫరెన్స్ అన్నమాట. ఈ కాన్ఫరెన్స్ ఒక ముఖ్య అంశాలు ఏంటి? వీఆర్ టాకింగ్ అబౌట్ సైన్స్, వీఆర్ టాకింగ్ అబౌట్ క్లినికల్ కేర్, వీఆర్ టాకింగ్ అబౌట్ రీసెర్చ్, వీఆర్ టాకింగ్ అబౌట్ ఎడ్యుకేషన్, వీఆర్ టాకింగ్ అబౌట్ అడ్వకసీ, వీఆర్ టాకింగ్ అబౌట్ ద పార్ట్నర్షిప్ between the public and private partnership. We are talking about the government and the FOXY partnership, and we have lot of advocacies with many of the partners, and like UNICEF India, the WHO in India, then the international organization BMGF, the Bill Melinda Gates Foundation, the Packard Foundation. So many foundations are associated with us. And for advocacy, we believe in women's health. We are gynecologists taking care of women's health. So for us, advocacy is very important. It's not only treating the woman whom we are seeing every day, but it's also to look into the fact that we see socially what is it that all of us can do as a society for taking care of women's health. Because unless the woman is having the best of health, we will not be able to achieve anything, I feel, in the whole world, not only in our country. ఈ విషయం కాకుండా మోస్ట్ ఇంపార్టెంట్ థింగ్ ఇస్ మెటర్నల్ మార్టాలిటీ రేట్. మన మెటర్నల్ మార్టాలిటీ రేట్ ఆర్ ద నంబర్ ఆఫ్ విమెన్ హూ ఆర్ డైయింగ్ బికాస్ ఆఫ్ చైల్డ్ బర్త్. మీకు అందరికి తెలిసిందే MMR. India was having a very big maternal mortality rate, but now we are very, very lucky and happy that the government is so keen, along with the federation, the FOXI, we are all working to try to reduce the maternal mortality rate, and we are extremely happy because Telangana has got one of the lowest maternal mortality rate. It's about 40 to even 36. It is not yet announced, but the now present value which is there, it's about 40s. And why I am very happy is because we are going to soon reach a single digit target. So we are all looking forward to the SDG, Sustainable Development Goals 2030, where India has to reach the SDG goals. We have to reduce the maternal mortality rate to less than 70. So hopefully we should reach this SDG goal by 2030. And with the commitment of the government, the central government, our Prime Minister Shri Narendra Modi ji, our Mansukh Mandavia, who is the Health Minister, they have been working very hard for the health of women. And all coming to the local governments, now we have a new government. We have Shri, I think, Revanth Reddy garu, who is the Chief Minister, and Rajana Simha garu, who is the Health Minister. They're just taking over, and I'm sure that they will continue the work for reducing the maternal mortality rate as the previous governments. We had the KCR government and Harish Rao was the health minister. They were all committed to reducing maternal mortality rate. So they worked very hard, and we gynecologists have supported them a lot. So the maternal rate had come down drastically in Telangana, and I'm sure the present government, the present health minister, and the whole government will work very hard to see that we achieve this single digit maternal mortality rate. So that is the aim of our FOXI, the vision and mission of FOXI. Then the other most important initiative which I had actually started was Dheera, No to Violence Against Women. Dheera ante courage. 2016 lo No to Violence Against Women initiative I started, and we as a whole have been advocating this. Because obstetrics and gynaecologists are the first point of contact. ఎవరికైనా ఏదైనా ప్రాబ్లం ఉంటే ఆడవాళ్ళు ఎవరి దగ్గరికి వెళ్తారు? ఫస్ట్ పోలీసు లాయర్లు దగ్గర కాదు, ఫస్ట్ వచ్చేది వాళ్ళ డాక్టర్ అమ్మ దగ్గర. అందుకే ఐ వాంటెడ్ టు సెన్సిటైజ్ మా గైనకాలజిస్ట్ దట్ వెన్ విమెన్ కమ్ టు అస్ దట్ వీ విల్ బీ ఏబుల్ టు గైడ్ దెమ్ అండ్ హెల్ప్ దెమ్, బీ ఎంపథెటిక్ టు దెమ్. అండ్ ద అదర్ ఇంపార్టెంట్ ఆస్పెక్ట్ ఇస్ Dheera will be successful if there is complete partnership. Men have to join hands with women, and the whole society has to come forward and say no to violence against women. So this Dheera initiative we started doing public forums, cyclothons, bikeathons, walkathons, radio shows, TV shows, so many media programs we have done. We have involved celebrities, the National Commission for Women, the SHE teams, the police, and so many other organizations, press and all, because unless everyone talks about it, the person who commits the violence will not get scared, because it's not possible. Everywhere in the world violence against women is there, not only in India, everywhere globally. So all of us have to join hands to say no to violence against women. Not only that, as the president of FOXI, I had actually initiated this Dheera online school certification course. This was in the partnership with the UNICEF India. So I thought it's best to catch the children young, catch them young, 9th to 12th class students. So it's a 2-hour online course, which we started as an online because it was a COVID time. Then we migrated to hybrid sessions, and then now physical programs also are happening. So many of my gynecologists in the country, about 6,000 gynecologists of FOXI all over the country, have become the master trainers, and they are training the schools children in different parts of the country. So ఇంతవరకు how many schools మేము కవర్ చేసామంటే more than 6,000 schools we have covered in the country, and about 300,000 and 3 lakh students have been covered the whole country with this program. And oka successful Dhira program has been even published in the international journal IJGO. And not only in India, I have been taking this Dhira to all the countries globally, because I'm the FIGO treasurer. This is the second term I'm running as the FIGO treasurer. The first time I was unanimously elected. Second time I had an election in October. I have defeated United Nations USA candidate and the Canadian candidate. Especially what was important was in the UN, United Nations, there was a meeting on racial discrimination of women for health. So I have represented FIGO at the United Nations, where I spoke about the commitment of our gynecologists for women's health across the world. For example, you must have all been hearing America law, the reversal of Roe and Wade case, where women's sexual and reproductive rights are not given importance. The women don't have a right for safe abortion. So Dani Gudam, we have mentioned this, and this was actually reported back in the AIOG Times and the New York Times. So that was a very successful initiation from our side, and I really feel very happy that I could do it. And the Dhira program, LASAC countries, Latin American countries, Cancun, Brazil, Tarvata Monna, Honduras, all these countries we have taken forward, and my team has done it even in Argentina. Europe lo Poland, Krakow, the European Union conference we have done this program. Then in Africa, in Kenya, we have done this program. And in other Europe, Italy also, we did in Venice. So globally, many countries lo మేము Dhira program ni conduct చేస్తున్నాము. So we have got lot of partnership globally. All the gynecologists across the world are joining hands with this initiative to say no to violence against women. And this is a very important project for women's health. Now coming to our conference, we have got about 110 international faculty who are coming for the conference. And locally, we have about more than 1,200 national faculty who are attending the conference to share their knowledge of the scientific updates. So we have a 5-day conference. The first day, 6th, we have got workshops. We have got about 14 workshops plus added one more workshop. Then 5 live workshops are there. Live workshops are there in laparoscopy, hysteroscopy, robotics, vaginal surgeries and oncology. మేము ఈ లైఫ్ సర్జరీస్ అన్నీ కూడా యశోద హైటెక్ హాస్పిటల్లో సర్జరీస్ అక్కడ అవుతుందండి. అక్కడ దెన్ వీ హ్యావ్ ద డెలిగేట్స్ హూ ఆర్ దేర్, and we have got the other workshops on sexual and reproductive rights are human rights, which are so very important, where we have partnering with the UNICEF and the other global platforms. Tarvata 6th ki workshops ayaka 7th we have the CG Saraya CM in the morning. Evening we have the inauguration. For the inauguration, our Health Minister Garu has agreed to come as the guest of honor. We are happy to have our Health Minister Garu, and we are actually waiting for the confirmation. Chief Minister Revanth Reddy sir also is likely to attend as the chief guest for our conference, because it's the biggest conference which is happening now after sir has taken over as the chief minister. So I'm sure this will be the first major conference which our Revanth Reddy Garu, who is the Honorable Chief Minister of Telangana, will be attending. We are all looking forward to have him with us. The whole country's gynecologists who are there are eagerly looking forward to see our new Chief Minister also at the inauguration. And we have got on the 8th, 9th, 10th, we have the conferences, 3 days. On the 8th afternoon, we have got the Dhira Public Forum. This Dhira Public Forum, we have got as a guest of honor our Minister, Madam Sitaka Garu. She is coming as the chief guest. ఇంకా వీ హ్యావ్ గాట్ సమ్ సెలబ్రిటీస్ ఆల్సో, ఎందుకంటే సెలబ్రిటీస్ వస్తేనే మీరు అందరు వస్తారు కదా, అప్పుడే ఇట్ విల్ బి పబ్లిష్. దిస్ ఈస్ వెరీ ఇంపార్టెంట్, ఎందుకంటే వై యూ హ్యావ్ టు పబ్లిష్ ఇట్ నాట్ ఫర్ శాంతకుమారి, అరుణ్ ఆర్ వింధ్య. మీరు ఈ వైలెన్స్ గురించి అగేన్స్ట్ విమెన్ మీరు పబ్లిష్ చేస్తే అట్లీస్ట్ చేసే వాళ్ళు అది చదివితే భయపడతారు. అట్లీస్ట్ ఓహో మేము ఇది చేస్తే వాళ్ళకి మిగతా వాళ్ళకి తెలుస్తుంది అని, అట్లీస్ట్ దానికోసమైనా మీరు కవర్ చేయాలి. మా పేరు లేకుండా దట్ ధీరా నో టు వైలెన్స్ అగేన్స్ట్ విమెన్ అనేది ఇంపార్టెంట్ ఆస్పెక్ట్. దెన్ వీ హ్యావ్ గాట్ అదర్ సెలబ్రిటీస్ ఇన్ ద ధీరా. We have got the International FIGO President, Dr. Anne Beatrice Kihara. She's from Kenya. She's my FIGO President. She's the guest of honor. And we have got Priyanka Dutt, who's a film producer. She's also coming for that inaugural of the Dhira program. And for that program, our Foxy president, Dr. Jaideep Tank and Madhuri Patel also will be there for the program. And 8th evening, we have our get together. We have invited some of the celebrities. Rana Dagubati is joining us. Nagashwin is going to join us. And Shobita is also going to join us the next day to be with us. And on the 9th, we have the Breast Cancer Awareness Forum, public awareness. Women's health is very important. We find that now breast cancer is also becoming very big problem. So awareness ni teyadaniki memu oka breast disease awareness public forum kuda chestunnamu. For this, we have got Frank Lowen as the chief guest. He is the president-elect of FIGO from Germany. Germany, Europe, many countries, even in Latin America, gynecologists only will deal with the breast diseases. Here we have surgeons, gynecologists, the surgeries, we have more the general surgeons and the surgical oncologists who deal, but then in the other parts of the world, breast diseases and breast problems, cancers, all surgeries are done by the gynecologists. So slowly, probably, we'll be bringing back in our country also change in the curriculum, because women actually go to the gynecologist, so the first point of contact. So not only screening, gynecologist should be a major part of this avoiding breast diseases in women. And that day we are having Mrs. Amala Akineni, who is going to join us for this breast cancer awareness, and Dr. Aguram is also going to join us that day, because he is also doing a lot of work for that. Then that day we have the ICOG convocation, and we are looking forward to have our governor madam. Fortunately, Tamilisai madam is our own gynecologist. So she's not there on the 6th and 7th. She's likely to join us on either 8th or 9th. Which day anedi she's going to confirm. She may be coming on the 8th afternoon, or she'll join us for the ICOG convocation of our college on the 9th afternoon. And we continue with the scientific programs, orations and other things. And the most important is, we thought koncham not only science and public awareness, we koncham spirituality kuda add cheyala mana conference ani we are having Sri Chinnajiyar Swami Garu, who is going to come on the 8th evening. He is going to address the gynecologist 5 to 6 p.m. And how we are also doctors, not only taking care of women's health, but we also need to have some sort of what to say, spiritual enhancement. And people, whenever they come to whenever you go to any particular place, whoever is that a region, whoever is the head of these sort of things, they would like to hear. So we are very fortunate that Sri Chinnajiyar Swamiji has agreed to grace our Congress and give his sermon, which will be really very good, as all the gynecologists are very excited to see the man who has created the very big statue of equality in our city. ఇప్పుడు అందరూ కూడా నేను బయట నుంచి ఇంటర్నేషనల్ ఎవరు వచ్చినా కానీ హైదరాబాద్ వస్తే నేను ఫస్ట్ చెప్తా, ఎయిర్పోర్ట్లో దిగాక ఇఫ్ దే ఆర్ కమింగ్ అంటే మరీ లేట్గా ల్యాండ్ అవ్వకుంటే అయితే అక్కడ నుంచి హాఫ్ అన్ అవర్ గో సీ ద స్టాచ్యూ ఆఫ్ ఈక్వాలిటీ అండ్ కమ్, బికాస్ వీఆర్ వెరీ ప్రౌడ్ దట్ ఈవెన్ అవర్ సిటీ హ్యాస్ సమ్ బిగ్ మాన్యుమెంట్స్. మనం వేరే కంట్రీస్ అన్ని పోతున్నప్పుడు చూస్తాం, వాళ్ళు ఏముండదు, దానికి చిన్న ఒక 2-3 అడుగుల స్టాచ్యూ పెట్టుకుని దానికి ఒక $50 $100 బిల్ వేసి మనల్ని చూపిస్తారు. ఇట్లా మనం అయితే ఫ్రీగా చూపిస్తున్నాం, $500 ఇంకా. సో and we have to be proud of what is there in our city. So that is the reason why actually we have projected the statue of equality on our brochure and all, because we want to, and this is to say that in Hyderabad, it's not only the center of IT, then the center of the economy, everything else, but we are the center of harmony, equality and spiritual wellness for all our people. So that is one of the attractions of the Congress. And 10th we will be having the last day, and 10th evening we have the valedictory program. Okay. So thank you very much. We look forward for your participation.
I think Dr. Shantakumari covered everything. In addition to that, I just wanted to say that the discussions in our conference are not only the routine maternal mortality and the health of the mother and the child. we'll be discussing about the latest technologies also and the research aspect like the robotics, the genetics and reproductive biology. All this will be discussed, and we have workshops for the same also. And we have so many international faculty who will be discussing all this. And then like our gynecologists or everyone, all the delegates will be learning from this conference.
And artificial